What I find so discouraging and troubling for the healthcare consumer, and why we've published on this, is that people will be hit with different messaging online from gurus who have a certain hypothesis, and well-intentioned, albeit it may be, it still ignores this data. So this is an area where we have ample data to answer the question. Hey everyone, this is Dr. Ruscio. Let's cover a number of questions from you guys on thyroid health, specifically within the theme of thyroid lab interpretation, thyroid medication, and the impact of gut health on the thyroid. And boy, if there was ever an area where the healthcare consumer had to be on the lookout for bad advice, there'd be two. One would be thyroid, and the other would be probiotics for SIBO. Today, let's unpack common questions and how we answer them based upon evidence. And I'll keep kind of bringing in this theme because it's so crucially important that we want to make our recommendations based upon good evidence, not based upon experts, gurus, or thought leaders, because they're amenable to bias. And this is exactly the reason why evidence-based healthcare exists, is so that preeminent thought leaders don't skew all thinking, and then we actually have something that sits above that in terms of the hierarchy of importance, which is the quality of evidence, good science. Also, I try to be careful about saying that you may have had an unsavory interaction with science in the past, where a doctor may have dismissed something that you thought and said, there's no science for that. And this is when it's unfortunate that science is used as kind of a cudgel, but we want to be true to science. And so let's go into the first question that is regarding thyroid lab interpretation, coming from Cecilia. And she asks, what is normal to my doctor is not ideal for my individual optimal health. What are the optimal ranges for thyroid lab tests, such as TSH, free T3, free T4, and reverse T3? And this is one area where conventional medicine really has this right. And most of the opinions, sadly, in functional, alternative, and integrative medicine are overzealous and incorrect. Here are the three principles, and I'll give you the evidence that underlies this in a second, but let's start with the answer to the question in plain language. Principle 1, there are no optimal thyroid ranges. We know that the conventional lab ranges here are actually correct and accurate. Now, it's not to diminish if you have symptoms. Symptoms are probably coming from somewhere almost for certain, yes. Does it mean it's your thyroid being suboptimal? No. So you want to be in the normal range according to Quest, according to LabCorp, according to the large amount of data that we have that reports on what normal should be. Principle 2, you only need to treat thyroid, and make sure not to change anything without checking with your doctor first, if your TSH gets above 7 to 10. Controversial, I know. I'll show you the evidence that supports this in a moment. And then principle 3, if you're having symptoms, but your thyroid labs are normal, look elsewhere to the cause. And this is really crucial. This is something we have published on, and this ties together if you're operating under the assumption that your thyroid could be the cause of your problems, and your endocrinologist said your thyroid is normal, but some of the messaging that you're reading online resonates in terms of why you have brain fog, why you have fatigue, trust me, this is the wrong road to go down based upon the best data, not based upon guru and thought leader opinion. But let's go into some of the evidence that underlies why we have this schematic. This really summarizes the evidence that we'll cover here in a second. But as you've probably seen, the cutoff for the labs is 4.5 for TSH. When you get above 7 to 10, this is when people start seeing benefit from using thyroid hormone, whether it be Levo, whether it be WP, whether it be Levo plus Cytomel, or maybe something like Tyrosint that's easier to absorb. So it's really the true hypothyroid cases that benefit from treatment are those that are above 10 regarding their TSH. Why this matters is other data that we discussed on the podcast in the past, where as researchers are double checking, was this person put on thyroid hormone correctly? let's test if they can come off thyroid hormone successfully. They found anywhere from 37 to 61% of individuals could stop their hormone, feel just fine, some even felt better, and maintain normal TSH. So it's crucially important that you don't fall into the trap that I'm not feeling well and it must be suboptimal thyroid that's driving this. So let's come to the data, and then I want to circle back to the other components of Cecilia's question, the free T3 and the reverse T3. But as it pertains to TSH, there is one really seminal data point. It's a meta-analysis of 21 randomized controlled trials. They took people, they said, well, what if people with sluggish thyroid, with suboptimal thyroid, with that mild elevation of TSH, what if they could benefit from the use of levothyroxine, from the use of thyroid hormone? So they tested this not only once, but 21 times across 21 clinical trials, looking at over 2,000 individuals. And what they found was that even though TSH normalized, there was no impact on depression, fatigue, cognitive function, or BMI. So this experiment has been run in terms of maybe people with sluggish thyroid, suboptimal thyroid, could benefit. But again, these experiments have been run, and what I find so discouraging and troubling for the healthcare consumer, and why we've published on this, is that people will be hit with different messaging online from gurus who have a certain hypothesis, and well-intentioned, albeit it may be, it still ignores this data. So this is an area where we have ample data to answer the question. Now, the debate regarding do you use just T4 or T4 plus T3, that's more mixed. I think there's an even case where some data suggests yes, some data suggests no, that a person might do better on T4 plus T3 as compared to T4 alone. This area, sluggish thyroid, is one where the data are fairly unanimous in showing that people don't seem, unfortunately, to benefit from thyroid hormone when their levels are suboptimal. And here's another study reinforcing this. Part of where this incorrect recommendation comes from, this recommendation that, let's say, your TSH should be 2 or below, is a target that perhaps when giving someone thyroid hormone, you want to give them more and more and more until their TSH hits 2 or below. And this has also been tested in a randomized crossover trial, meaning you were in placebo, and then once round 1 of the experiment was done, you then went into treatment group and the treatment swapped with the placebo. So it's very accurate with this crossover design. And they found that getting the TSH lower, below 2, did not lead to any additional improvement in hypothyroid symptoms, well-being, or in quality of life. So with data like this present, it's really hard to operate underneath the paradigm that it's thyroid. Now, to the person who's saying, but I don't feel well and I need to feel better, I hear you. But it doesn't mean that we can just force the thyroid as the cause. And this is why it's so important to look more broadly to other things, of which I'll come back to some of what those are in just a moment. But I want to also share with you how one should filter information. This diagram that you're seeing here, it's the evidence-based pyramid for how we sort and evaluate data regarding patient care. At the bottom, you have expert opinion. So the guru who wrote the book, or the person who had a compelling lecture on a podcast that you listened to, this is actually the lowest level of scientific evidence. Whereas the highest level of scientific evidence are meta-analyses. Now, we don't always have meta-analyses. Sometimes there's a paucity of data and we just have to speculate. And this is where thought leader opinion has a lot of value, because there's no good science. And so the person in clinical practice, hopefully getting a read from what they see clinically, is the best we have. That's not the case for this question in particular. Now, coming back to the reverse T3 and free T3. By the way, markers early in my career I routinely ran, for which I no longer do. And this is because reverse T3 and T3 are almost always a byproduct of something upstream: stress, inflammation, impaired gut health, low carb, low calorie, poor sleep. So when you evaluate those, you're not actually looking at thyroid function. You're looking at downstream metabolism that's influenced and dictated by all of these other factors. So if you're trying to appraise the function of the thyroid gland, albeit this is controversial, and unfortunately, TSH is really the best. You can pair that with free T4, yes. But again, we've run this experiment. We've tried treating people with mild elevations of TSH, the sluggish thyroid, the suboptimal thyroid. And like I shared with the meta-analysis of 21 trials, no benefit. The good news here is that it means there's somewhere else you can look to for what's driving those symptoms, of which we've already hit a few. So Carol asks a similar question. If your thyroid labs are normal, can there still be a problem with your thyroid gland? And again, this is something that we've published on. We published 2 papers in 2022 on this because it's such a common problem and there's so much confusion about this question. Now, that's a broad question. I'll give a broad answer, understanding there's always going to be some exceptions. But generally speaking, if we're talking about your thyroid function regarding autoimmunity and hypothyroidism, if your TSH and free T4 and TPO are normal, then it's very unlikely there's any issue with your thyroid gland. In fact, we've discussed in the past this other marker of thyroglobulin antibodies, that it has a very poor correlation to thyroid health. So even within some of the available testing, some of the tests have poor correlation to thyroid gland status. In fact, there was one really compelling data point, and if you want to see a more thorough unpacking of this, we did a whole video on the utility of thyroglobulin antibodies, and amazing study in that they documented that ultrasound findings, so as the gland becomes progressively damaged, you can see it on the ultrasound. The tissue becomes hypoechogenoic, meaning there's less echo because it's scarred and dense. That correlated with TPO. More scarring, more damage, higher TPO, did not correlate with thyroglobulin. So even within some of the routinely available lab markers, those markers don't correlate. If the markers are all normal, it's very unlikely there's any issue with your thyroid. You may still have symptoms, and there is likely a cause of those symptoms, but it's probably not the thyroid. Again, always check these things with your doctor because there are other conditions that can be present, like a nodule, but as it pertains to autoimmunity and hypothyroidism, probably not. Raj asks, my TPO antibodies are 1,500. This is high. My TSH is 6. This is high. Free T4 and free T3 are normal. I am taking levothyroxine. What does it mean if my TSH and TPO antibodies are high? Well, if you're on levothyroxine, then you may be inadequately absorbing that levothyroxine. And we've published on this. There's also a number of papers that have found that suboptimal gut health can drive poor absorption of thyroid medication. And by using various tools, rifaximin, probiotics, just to name a couple, you can improve absorption and normalize the TSH. So if there's a degree of GI symptoms present, that increases the probability that this is occurring. Now, it's also possible you simply need a higher dose of the levothyroxine. So it begs the follow-up question back to you. Have you followed up with your doctor? Have they increased your dose? If there's this pattern over time of inconsistency in your TSH levels, then it's more likely that there's malabsorption present. If you're just starting into this road, then you may need a few dose adjustments to find the dose that consistently gets you to a TSH of below 4.5. Now, the antibodies are high enough to where they should be addressed if you're not addressing them already. Vitamin D, 83 micrograms of selenium plus 600 milligrams of myo-inositol have been shown to be helpful in lowering thyroid antibodies and also TSH, as well as a few other interventions like improving your diet quality. This is where a paleo elimination diet template may be helpful. So those antibodies are high enough to where you should perform some sort of intervention supportively if you're not doing so already. And the TSH may indicate inadequate dosage or inadequate absorption or both. Coming over to thyroid medication, Jess asks the question, I was diagnosed with hypothyroidism 25 years ago and been on medication since then. Is there a safe way to establish if I truly need thyroid medication? And this is a great question. And what was surprising to me and a little bit counterintuitive to me to learn, again, based upon the evidence, based upon the data, not my opinion, in some longer term follow-up studies, it did not matter how long someone was on hormone if they could successfully come off of it. So length of time on hormone does not dictate if you can successfully stop. What did and what does is the level of elevation of your TSH at diagnosis. Sound familiar? And also your level of elevation of TPO antibodies at time of diagnosis. The higher those are, the more likely that you will need to be on medication in perpetuity. The lower they are, the less likely. Now, what do these stats look like? Well, thankfully, like we talked about a moment ago, a meta-analysis found that 37% of individuals who had an unclear diagnosis could successfully discontinue their medication, feel just fine, in some cases feel better, and maintain normal levels of thyroid hormone, meaning they did not need the medication. A different meta-analysis by Levanas found as high as 61%. So we could say maybe 40-ish% likelihood. Now, if you can obtain the labs that diagnosed you from before you went on thyroid hormone, you can appraise this. You can look at, most importantly, your TSH and see how high it was. If you were above 7 to 10, then it's likely you'll need hormone. If you were 20, if you were 40, if you were 60, if your TSH was a 6, data here has shown that up to 74% of cases will see that mild elevation of TSH, that sluggish thyroid, that suboptimal thyroid, go back into the normal range all on its own with no intervention, 74% of the time. Now, you can increase the probability of that with the 83 micrograms of selenium and the 600 milligrams daily of myo-inositol. If your TPO antibodies were highly elevated at time of diagnosis, that also increases the probability that you'll need the hormone. But remember, you can run this experiment underneath the guidance of your healthcare provider, and the protocol, and we'll come to this in a little more detail in a moment, essentially is to stop the medication and then retest 6 to 8 weeks later. And one of two things will happen. Your TSH will go very high, or your TSH will stay in the normal range. And if it's in the normal range, yay, cause for celebration. You are like 37-ish% of the population that may not need their thyroid hormone. Again, don't do anything without checking with your doctor because I don't know all the details here first, but this is what the data tells us, and this is the approach you'll want to discuss with your healthcare provider. And an audio question from Sarah.
Hi, I've been listening to some of your newer content you've released regarding medications for thyroid that may not actually be required, and I feel like I may fall into that category. I've been on Synthroid and Cytomel for several years and wondering what the process is for weaning off of these medications, especially the Cytomel. Of course, I realize it's important to work with a healthcare professional, but I was wondering if you could just tell me a little more about the process. Thank you.
Okay, well, thank you for your question, Sarah. And remember that there's some historical data, if you can obtain it, that helps with the prediction here, with the prognostication. Meaning if your TSH was very high, above 10, and in many cases it's above 30 or so, then that's very suggestive that you'll need hormone ongoing. If it was 5, 6, 7, 8 sluggish, then it's very likely that maybe 40% that you will not need the hormone. There have been two protocols used. The simple bottom line is you need 6 to 8 weeks off the hormone and then retest to see what your TSH levels show. Now, two general protocols have been used. One is cutting the dose in half and then discontinue after that. in 1 week increments. And I'll put this up on the screen. So week 1, half your dose. Week 2, discontinue completely. The other protocol that has been used, and this comes from a recent meta-analysis, you decrease the dosage by 25 micrograms of T4 or the equivalent amount of T4 with T3 in your case. And you do this every 3 to 4 weeks until you're at less than 25 micrograms per day, then discontinue fully. It's not a super fastidious process. It's not to say if you don't do this exactly the right way, you're going to fail the experiment. You may have missed doses before. Some people are even unsure if the hormone helps them, and they've had a week or 2 or 3 off historically. And if they've noticed nothing, or in some cases, you'll hear people say, I actually felt better. These are good indications that you don't need the hormone. However, if you've missed doses, or maybe it was a week from refilling your prescription and you felt poorly, then you may want to go with a little bit more of a measured, gradual approach. And again, just discuss this with your doctor. The important thing is that you have an appraisal after 6 to 8 weeks, and then it'll be very revelatory in terms of your TSH will either go above that 7 to 10 cutoff, means you need hormone, or it'll stay in the normative range or just slightly elevated, sluggish. And again, those cases generally do not benefit from, nor do they need thyroid hormone replacement. And moving on to a question regarding the gut-thyroid connection. Diana asks, my doctor is adamant about me taking NP thyroid. Always a bad sign whenever a doctor is adamant. I mean, with exception, right? But in the functional realm, if you feel like your doctor is being adamant for no good reason, then that's a red flag in my opinion. Adamant about me taking NP thyroid because my TSH is 1.18 and my free T3 and free T4 are low normal. This is where we get into so much trouble with the wild speculation that occurs in the field of functional medicine, sadly. I currently have significant bloating. Is it possible my digestive symptoms could be causing my thyroid issues? Well, firstly, I would not say you have any thyroid issue. Your TSH is fine, and being low normal for the free T3 and the free T4 does not matter. We can't micromanage people's hormones. We want to give the body what it needs and then let it metabolize it as it sees fit. So I don't think there's anything wrong with your thyroid hormone. If you had asked me this 5 years ago, I may have gotten on the bandwagon of saying, well, conventional medicine has broad ranges, functional medicine has narrow ranges. And after testing that and publishing on it, we see fairly clearly that this hypothesis does not have merit. And that, yes, the fact that you have bloating could be causing other symptoms. Perhaps you have fatigue or brain fog. It's possible that those other symptoms are being driven by your gut as evidenced by the fact that there's bloating present. But on its face, the TSH of 1.8 and the low normal of free T4 and free T3, are no cause for alarm. And again, this is one area in the field that is incorrect. We have good data to answer this question, and it's really important that we start updating our opinions from the antiquated hypothesis of needing optimal ranges to now understanding, get someone into the conventional ranges. If they're not feeling well, look to other areas to be driving the symptoms. And this is where we've published, in just a quote from our paper, hypothyroid symptoms can also occur from poor GI health. For example, IBS has been associated with fatigue, worse quality of life, depression, anxiety, and sleep disturbances. SIBO has also been associated with both depression and anxiety. So your lab values, normal, this is what conventional medicine has right. And if there are other symptoms, it is possible that those are being caused by your GI or something else. And maybe in close, one of those other things can potentially be you not eating enough. This can happen if your provider is saying, well, oh my goodness, your thyroid levels are suboptimal. And, air quotes here, we know that part of what can drive that is gluten. Therefore, get off all gluten. In fact, while you're at it, get off all grains, also get off dairy. And before you know it, we end up in this fairly common, so disturbingly, scenario wherein people for no good reason are overly avoiding food. Then they can be undereating and or undereating carbohydrates. This can cause fatigue. This can cause poor sleep. And then we cascade and snowball. So if you're being overly avoidant with food, be attentive to that. And also just sort of to bring everything home, there are some areas in which I feel as though I'm in the contrarian position, and thyroid is one of them. But I always want to give it to you straight. So what the data support is what I will follow when we have adequate data to answer a question. So this is an area, again, like SIBO and probiotics, that we have ample data to answer the questions that have been posed today. So that's what I follow. Now, it so happens that the opinions of some of conventional medicine correlate with what the evidence shows, and they're wrong in others. And the opinions of functional medicine are correct in some areas and wrong in others. What I think functional medicine is doing well here is helping people to see that dietary changes, supplementation with vitamin D, selenium, and myo-inositol can be helpful. What they're doing wrong is telling people there are optimal ranges. And this is what conventional medicine is doing right. Conventional medicine is giving people straight talk on the labs and not regarding these optimal ranges as something to be concerned with, because there's no evidence proving that. In fact, there's evidence disproving that. However, conventional medicine sometimes seems to be a little bit lackluster regarding dietary changes and nutritional supplementation to improve thyroid health. So you have to pick and choose from each camp. But at the end of the day, if you make decisions that are in accordance with good evidence, you'll have better outcomes, you'll have better health. And that's always my goal for you, to give you science-based, unbiased advice so that you can improve your health as quickly as possible.